Today I want to talk to you about something that a lot of our pregnant clients are coming to us and talking about, and that is hemorrhoids. So I know, kind of a fun topic, but during pregnancy, hemorrhoids are something that a lot of moms will experience, and they can really be no fun. So we're going to talk about what they are, what some of the symptoms are, and what are some of the things that you can do to prevent or to reduce what you're experiencing with the hemorrhoids. So first, they're common during pregnancy, but what are they? So hemorrhoids are literally swollen veins in the rectum area around the anus. And they're common during pregnancy because the pressure of our growing baby on our pelvis and the pelvic floor area can create compression and irritation and swelling in those veins. Also, during pregnancy, we have increased levels of the hormone progesterone, and that hormone helps to create relaxation in the blood vessel walls to allow more stretch and give, and this can allow for more swelling to happen because things can kind of stretch into the vessel walls much easier. So that's some of the main reasons why we'll see it happen more during pregnancy, like I said, because of the growing baby putting pressure on the pelvis and the veins in the pelvic and rectal area, as well as the increased laxity in the tissue of the veins, allowing for more swelling and stretching. So what do they feel like? So if you've never experienced them, cool, let's hopefully keep it that way. But symptoms of hemorrhoids can be burning, itching, stinging. Sometimes you might have bleeding, especially with a bowel movement that's firmer or larger. So there's a wide variety of symptoms that you might feel if you are experiencing hemorrhoids. If they're external hemorrhoids, you might have some little bumps or areas around the anus as far as when you see those blood vessels kind of bulging out a little bit more. So that's also something that you might experience. So what can make them worse? Okay, so two main things that make them worse are prolonged sitting or prolonged standing. So in prolonged sitting, we're getting extra compression and pressure down through the area. And in prolonged standing, gravity is giving us extra pressure and fullness down into the pelvis. So you're better off switching positions more. Other things that may make hemorrhoids worse are having to strain to have a bowel movement. So holding your breath and pushing as hard as you can. That extra pressure through there can get them to come on, because pressure is always going to go where there's the least amount of resistance. So if these veins are prone to be stretching out more, then we are going to have the pressure kind of go that way. So we might end up seeing the hemorrhoids form then. A really common cause that a lot of pregnant women experience is constipation. So over 40% of women will experience constipation during their pregnancy. And constipation leads to more straining and that with bowel movements, and is a big cause for potentially getting hemorrhoids. So you have them or you want to try and avoid them, what can you do to make a difference? So we're going to talk through some different tips that may be helpful to prevent or to hemorrhoids or to minimize what you're feeling if you're already experiencing them. So first, there's some dietary changes that you can do. You should be making sure that you are drinking plenty of water, okay? Many women are not properly hydrated during pregnancy, and this can lead to constipation, which is, again, a cause for the hemorrhoids potentially. So as far as how much water, I usually go with what color is your pee. That your pee should be a pale yellow, and if it's anything brighter than that, then you're not getting enough water in. So that's how I usually tell my patients to tell if they're drinking enough water. Another dietary change that you can do is to make sure that you're getting enough fiber into your diet. Now, this doesn't mean that you have to supplement. Honestly, it's better in your natural form. So this means eating more fruits and vegetables. This is something we all should be doing anyways, but getting more of them into your diet can be really helpful so that you're getting your fiber intakes up so that we are keeping our bowels moving along regularly. That's how fiber can help us there. So those are the two dietary things, getting in more water and getting in more fiber. Do not increase one without the other. Both of those, if you're trying to increase them, you need to increase the other to make sure that your bowel movements are still going smoothly. The next thing is a positioning thing that you can do to help when you actually are having the bowel movement so that you don't have to strain and it's easier to pass. And that is to use a stool to pass your stool. So Jamie was live a week or two ago talking about proper toileting positions. So if you didn't see that video, you should go back and look at it. But in that video, she talked about the fact that we should get our knees up higher than our hips and be in a squat position in order to have a bowel movement. It just opens up what's called the anal rectal angle, and it allows the fecal matter to slide down and pass a little bit easier. So our stool that's our favorite is the Squatty Potty. If you don't have that, old phone books or any type of stool that you have at home to let you get your knees up higher than your hips can be very helpful. So using a stool to poop can help take some of the pressure and strain off. All right. Another thing that you can do is to change things positionally. So we talked about this one already, that prolonged sitting or standing can cause increased hemorrhoid symptoms. So change your positions often. So we know you're going to need to sit, we know you're going to need to stand. Can you go back and forth and move around more versus being in either one of those for any prolonged position so that we minimize the amount of pressure and stress down through the pelvic area? A second or another thing that we can do to help in the area is to start doing our KEGEL exercises. So remember, our KEGEL exercises are a contraction and a relaxation of our pelvic floor. So when you contract it, it's like you're trying to stop the flow of urine, and when you relax, it's a let go. So that back and forth motion of the muscle contraction and relaxation helps to improve circulation and to minimize swelling in the area. It's the same theory as when we've injured our ankle and it's all swollen. We do some gentle ankle pump motions back and forth to improve blood flow and to help get rid of the swelling in there. Same concept going on here. So this is it, squeezing as tight as we can. It's just gentle back and forth motion, doing our KEGEL exercises to improve circulation and to minimize swelling. Some things that we can use to kind of help prevent that discomfort from the hemorrhoids, if we already have them, is to use a cold pack. In this area, my personal favorite is a little DIY cold pack where you put some witch hazel onto a sanitary pad and put it in the freezer to freeze up. And then you can place the pad in your underwear as needed for that extra cool support through the area. That can feel really comforting for the hemorrhoids. Another recommendation would be to take a SITZ bath, and to help, that helps kind of with relaxation and kind of calming the irritation and the symptoms. So that's another thing that you could do. And another thing for comfort is to potentially switch what you're doing to clean yourself, that you use a flushable wipe, or maybe you use a little squirt bottle with water in it to try and squirt the area clean, and then you're kind of patting it dry. Anything to kind of minimize the irritation from the wiping around the anus there can feel better. So there, I think I just went through 8 recommendations of things that you can do to help prevent hemorrhoids and to help make them feel more comfortable if you're already dealing with them. So try them out. Hopefully they help for you if this is something that you're having to suffer through. We hope you're not suffering more than you have to, and can try some of these things to make everything feel better. So if you have questions, drop us a line. We're here to help. But hopefully you guys are all having a great day, and we'll talk with you again soon.